Oh, well, hello, everybody. Dr. Rahi Victory, reproductive endocrinology and infertility specialist, double board certified for whatever that's worth. And actually, kind of, I guess, triple board certified because I'm licensed in Canada, the States, and the UK now. So, certified all over. And I'm here with my very dear friend, Tarek Ibrahim from the Ibrahim Strategies Group. Big round of applause.
Hey, everybody, welcome to the show.
We need one of those. We need like one of those panels of
I
buttons
know,
with
for
sounds.
sounds. I
Yeah,
believe you.
we
It's
got to
up
do
here.
that.
It's up here.
Yeah. Welcome back to the show. For those of you that are new, it's a fertility show. We answer questions live. I think we're the only program out there that answers questions live on a regular basis.
Definitely
like
on a
this.
regular basis, you are.
I think we are.
Not
Yeah.
on a one-off.
Yeah. I think we were the originals too. No one else was doing it live.
Absolutely the original.
Yeah.
This whole thing
Yeah.
in the fertility world.
We should call it Fertility Live OG. We could just change it from Fact or Fiction.
Absolutely.
There is usually a study or something that we share. Unfortunately, there really haven't been any good ones. There is one that I will review that we kind of briefly alluded to last time. So I'll probably set that up for next week. And that's an exciting paper looking at a whole bunch of different elements of how AI will integrate, but specifically if it can predict whether or not you should even bother doing an IVF cycle, which I think is super cool and probably terrifying to a lot of IVF businesses, which I kind of like, because it's actually going to help guide people so they don't waste their money on unnecessary, useless treatments, because I see that all the time. So very excited about that. I will review that study for you guys, hopefully coming up soon. Otherwise, kind of copacetic. Everything's been going well. We will be starting our IVM program finally very soon. And we're also going to be starting our PGT program now. So that'll be up and running. So a few new developments. We're going to have our own in-house PGT program. We won't need to send the embryos out anymore. We can do everything in-house or the biopsies out. Had a great dinner with a friend and colleague recently, kind of hoping they'll partner up with us somehow or join us in some capacity. So excited about that as well. More news to follow when I finalize things. And so, yeah, there's a lot of exciting things happening at VRC. Very, very, very exciting things. Yeah, very cool. Lots of research coming out. There is some data on whether or not tretinoin or retinoic acid, isotretinoin, which is a commonly used drug for acne based on a vitamin A acid gel derivative, can actually help men with very poor sperm quality. So Dr. Khosravi, our illustrious lab director, found this out, brought it to my attention. We kind of delved into it a little bit more. Turns out it's not just good for azoospermic men, it might actually be good for guys with just weak sperm. So we're actually going to explore using this in some of our guys, kind of kill their acne and improve their sperm quality at the same time.
Bonus.
I haven't, what's that?
Bonus.
Haven't figured out the mechanisms yet, so I need to read about it a little bit more. But looks like it could be like a massive game changer. Like a huge number of these guys that were producing zero sperm actually started making very reasonable quality sperm. And even for the guys that had not great sperm, but some sperm, they actually were improving as well. So I think that this may be something really exciting to look at and explore, because this may change the whole game. And I'd never heard of it before. Like, I don't think a lot of people are doing this. So I'm really excited to try that out and see if it works. So yeah, we've got a couple of interesting research studies and programs coming. Some other exciting developments we're working on. I'm very excited to be attending the Canadian Fertility Show in just over a month. That's going to be in Toronto at the Harbour Castle Westin. We will have a talk there and our booth. And so if you are not from Windsor and you want to come out and meet us and see us and talk to our team, please come to the Canadian Fertility Show. It's going to be awesome. Very excited about that. Run by Marissa Thompson, who owns it. And she's phenomenal, an amazing naturopath. So please, please, please get your tickets now. Come out and see us. We're trying to get more people out there to visit us and see us and learn about fertility. So come on out if you get a chance. I think that's it.
You ready?
Mm-hmm.
You feeling good?
I'm feeling good.
Because it's ready for you.
We had a good dinner.
We had a great dinner.
Mm-hmm.
Let's begin.
Okay.
Ladies and gentlemen, thank you for joining. The first question of the day. I didn't cherry pick it, guys, so it's just the first one. What do you recommend for egg retrievals as my last two, all my embryos stop growing after 3 days?
Well, if your embryos are stopping growth after 3 days, that's likely indicative of a sperm problem. So I don't think that has anything to do with you at all or the retrieval. That's probably a sperm issue. So you'd have to have a very close look at the sperm to see if it's a sperm problem. So that's where I would start focusing on. If they did think it was an egg quality problem, I need to know lots of details about you, your BMI, your social habits. Are you lean? Are you not lean? What kind of diet do you have? How high is your stress level? What sort of supplements were you on? What were you doing to maximize your egg quality and production? What protocol did you use? All of those things can be really important. So it just depends on what's going on.
TikTok is falling behind in terms of likes compared to all the other platforms. So
pump up the TikTokers. TikTok, what are you doing to us? You usually represent. Show up and give us the likes.
There we go. Here we go. We got 219. All right, let's go, guys. Let's go. We're watching everything here.
Yeah.
Hi, Dr. V and Dr. T. I'm on E2 patches plus Tacro for transfer prep.
Okay.
Lining 8 millimeters, but serum E2 is low despite same patch dose that gave higher E2 before. RI said low E2 led to miscarriage before. Your thoughts?
Absolute nonsense. There's no evidence anywhere that low E2 leads to miscarriage. In fact, low E2 is beneficial. So until someone can show me a study that demonstrates that low E2 leads to miscarriage, that's not true at all. And you don't need to have a threshold level that's actually been studied. There was one study we reviewed probably 3 years ago that said that you want like a minimum of 100 picomoles, but like everybody's at that level. So I wouldn't worry about that too much.
Hi, Dr. V&T. Are there risks of ceremimis causing ovarian cysts?
Yeah, there actually are. So there are some studies that have included the fact that ceremimis can cause ovarian cysts. The problem is, for the people that need ceremimis, it's probably worth it to just go for it. So I would recommend to them that they actually just try and see what happens.
Superstar T.
Oh,
that's me. And Dr. V.
That's me.
That's
just
you.
I'm just Dr. V. I'm not superstar Dr. V. I'm just Dr. V.
I'm blushing.
I love the shoulder shrug. Like, yeah.
They love me. They really love me.
All right.
I have a microbiome issue.
Okay.
Moderate ureaplasma, very high staphylococcus, low in 2 other things, and low lactobacillus.
Sure.
Immune issues, high NK cells, low TREGs, and likely endo. I'm 35 and AMH went from 19 to 12.
Oh.
Do I have a good chance with you as my doctor? Feeling a little hopeless.
Oh, yeah. I mean, we can easily fix your microbiome. If not easily, we can fix it. We can definitely fix your immune stuff. So that's not difficult. The chances would be excellent. Remember that in the patients where we did Fertilysis, 91% of those patients got pregnant afterwards. So you got a 91% chance. That's pretty good. And that was with their first transfer after the Fertilysis testing and treatment.
I take odds like that every day.
Like that, it's sky high. When you really think about that, because like even I was shocked when they gave me the numbers, right? And you think about it, like these are the bad patients and they're getting 91%. Like nobody in the world's getting that anywhere. Nobody's getting 91%. Yeah. We did manage it for 3 months this year. So I was very proud of that. I think it was February, March, April. So we had phenomenal results those months. But like the Fertilysis stuff makes a difference. That's why we do it. Yeah.
If there's anything I learned on this show, and there's a lot of things I learned, I'm constantly learning. I am like a sponge of knowledge when it comes to women's bodies. But on a serious note, really, the can't do it, eh? It's a good one, right? So on a real note, the amount of the benefit of immune testing and the knowledge of knowing that area there from an immunological perspective,
Yeah.
I think this needs to be like basic infertility treatment.
So it's so funny how many people, I'm still laughing. It's so funny how many people like don't believe in it still. Like not people, I mean doctors, they're like, no, that doesn't work. That's not important. I had another patient today from Switzerland. She's Finnish and I won't spill the beans, but he's from somewhere else. And a beautiful couple, so beautiful. They were really friendly and polite and nice too. And I was talking to them, and she's like, "I think I have endo." So I talked to my surgeon and my fertility specialist, and he said, "Yeah, it doesn't matter. Just keep doing more IVF." I was like, "No, you can't keep doing more IVF." So, and someone actually mentioned an abstract, which is for, I'm not sure which meeting. It might be ESHRE. No, it couldn't be ESHRE. ESHRE's passed. I'm not sure what meeting it's for, but someone showed me an abstract from an Italian group that actually did a randomized controlled trial of sending women directly to IVF who had endo or to surgery first. And the people that had the surgery did way more poorly than the people that went straight to IVF. But here's the thing. We never advocate for people to do surgery if they're doing IVF first. We always recommend do your IVF first and then do the surgery, because then you get an even higher success rate. But for the people that have endo and go do surgery first, you should only do that if you're trying to avoid the IVF, because it's going to increase your chances over natural. And it clearly did, because these were all people with infertility who then subsequently had about a 25% chance of getting pregnant. So yes, it improves your chances, but it's not as good as doing IVF. What's best? Do your IVF first and then do your surgery plus our endo protocol and then try and get pregnant. So, all these nuances are super critical.
So there's a question that popped up related to the Fertilysis and all that.
Yeah.
Is what is the Fertilysis testing?
Oh, so Fertilysis is a company in Greece. They do PCR-based next generation sequencing of bacteria. This would be both vaginal and uterine based on testing your menstrual blood. And they give you kind of a breakdown of categories: low, high, medium, whatever, very low, very high. And they break it down into groupings that you can then go ahead and treat. On top of that, they also offer pretty advanced immune testing. So NK cells, T regulatory cells, cytokines, KIR mismatches, all sorts of stuff. Interesting thing with all this is that we've been looking into it. It's actually quite expensive to do. And they are quite expensive now, but it's quite expensive to actually run the test. So we're kind of looking at doing it ourselves, and we're trying to figure out the immune part, because I can nail the microbiome, but the immune part actually may be challenging to be competitive cost-wise. We could probably match them, but I'm not sure we can beat them. And I love them because they're friends of ours and we really like them. So a great company. They do good work. Takes about a month to get the results. It is not cheap. I warn everybody in advance. And because we're not allowed to support one company over another, I don't promote Fertilysis over anybody else. However, I will critique other companies who don't produce a good product. For example, one specifically well-known company in North America that does a test for microbiome that believes that 20% of patients have a sterile uterus or vagina, which is biologically impossible. Not possible to be sterile in there. So I don't know what they're thinking when they said that, but they were adamant that they were right. They're not. Yeah.
Does CoQ10 have benefits for an FET cycle and pregnancy?
Probably not. Who is it?
I gotta get up.
Sorry, folks.
All right, we're back.
Who was it?
Live paused.
Is it paused?
Oh, you're good.
Matt. Oh, anyhow, that was my son calling in the middle of the show. Yeah, CoQ10 probably not super beneficial during an FET. Reasonable and certainly won't harm anything, but likely not necessary.
Any hope? Oh, what supplements are you reminding for lining?
I think they mean recommending.
Yeah, probably.
For lining, vitamin E, aspirin, C and D, they'll probably help a little bit. Some people talk about L-carnitine and L-arginine. Supposedly they help, but I looked it up. I couldn't find any clear-cut evidence, although there were some studies, but nothing great. Those are the only supplements you can use that will increase lining thickness.
We love Dr. T, and I love you too. I just got my Fertilysis results. I have low T
regs
and full HLA match with my spouse.
Okay.
Do I have any chance of conceiving? Have you seen any success with LIT and IVF with these results?
Oh yeah, for sure. LIT will help with the T-regs and to some extent with the full DQ alpha match. Aside from that, you're looking at doing a little bit of additional probably immune therapy. Plus, sometimes we use heparin in those cases. So that would be totally reasonable.
We're on to the next. I'm 42 years old.
You need another battery?
No, that's just the charger so I don't forget it. I just figured I'd get ahead of it. AMH 1.2 with an 18 millimeter endometrioma.
Okay.
First round IVF, Menopur 150 IU, Gonal-F 375 IU.
Whoa.
Equals 1 PGT tested low mosaic embryo.
Cool.
Would you change the protocol for round 2 of IVF?
Yeah, I would prime you, number one. Number two, we would not use anywhere close to those doses. That makes no sense at all. We know from studies that you're frying your ovaries, so you don't need that much. Maximum like 225 Gonal-F 150 Menopur, maximum, preferably even lower. And then it depends on what they did for your eggs, your trigger, the rest of it. So I don't know that stuff, but we always double trigger. That's proven to be beneficial. We just reviewed that on the show about a month and a half ago. We would use high antioxidant media or Neupogen media for you, also proven to be beneficial for older patients. We would do oocyte activation. Like there's a bunch of things we would throw at it.
To my superhero docs of reproductive medicine.
Oh, love that.
It's also plural.
We got to get like a cave.
Superhero docs. Big fan of that one.
Yeah.
I have you in part to thank for my beautiful toddler.
Oh.
Question.
Yeah.
Going into my upcoming FET,
yeah,
would it be okay to continue breastfeeding just at night?
No. You cannot breastfeed and do IVF. Your prolactin levels are going to be raised, even if they're not biochemically raised, they're higher than normal. And you are suppressing your endometrial response. Your body is not supposed to get pregnant while you are on breastfeeding. Or while you are breastfeeding. So do not do that. Please, I beg you, stop breastfeeding. You will massively cut down your chances.
Dr. V.
Yeah.
You're on silent mode.
Oh, there you go. Look at that.
By the way, reducing your chances, but not eliminating your chances, I think is very important for people to know.
Sorry, TikTok. Yeah, reducing. You're gonna
for sure in FET, maybe you're gonna
drastically reduce
for sure.
It would be bad
in general, because some people believe that if you breastfeed, you can't get pregnant, and then they found themselves.
That's true.
So
yeah,
that is a wives' tale.
But we're talking frozen embryos.
That's right. We are.
Yeah. We're not talking about spontaneous.
This information can't be put in other categories. What's for an FET is not for normal pregnancy.
Is not for normal.
That's right.
True. Yeah.
People need to know that. I learned the hard way. No regrets, but it's just false information.
Tarek has a lot of children, people.
Yeah, and they said you couldn't.
And
I said, sure, sounds good to me. Natural. Isn't that meant to be good? Turns out,
Oops.
oops. Hey, Dr. V and Dr. T, have you had patients with bad egg quality have better egg retrieval results after endometriosis excision surgery?
Yes. Yeah, we do. But you got to be careful because the stim will worsen the endo. So you're retrieving, then you're making it worse. Then you might have to you're operating, then you're doing the retrieval, which makes the endo worse, which means you may need to reoperate. Very rare, but it's a possibility, and we don't want to reoperate on people. So we desperately try to avoid that whenever possible.
So there's a couple of questions regarding Fertilysis testing, saying there's so many of them, which one to choose. So there's like 4 or 5 people asking similar like questions. So
our patients get like a panel. They get a special code because they're our patients and they get a discount. So if you're our patients, you just ask us and we help you. For those that are doing it on their own, they have a full female microbiome, and then they have like a alloimmunity and I think an autoimmunity. So you can get the basic one or you can get the full one, which basically just adds on KIR HLA typing. So we have 2 separate panels. One's the full microbiome with the basic immune panel, which is still very advanced. And then the other one adds on the KIR.
Hello, doctors. Do you always use assisted hatching?
Mm-hmm.
If so, why?
We do. The evidence for assisted hatching keeps coming and going. There was just a recent study again that said don't bother, it's of no value. But first of all, you have to do assisted hatching if you're doing biopsies for PGT. So that's necessary. You can't avoid it. And then the other thing is like it makes sense to help the embryo hatch. And there was older data that showed that like if the zona was really thick, which is like the shell, if the patient was older, it was beneficial. So we know that there are certain categories where it might be beneficial. We just do it for everybody. It's definitely harmless. We believe that there is an improvement in the outcomes. Plus, it's necessary in a lot of cases because they're doing the PGT, so you kind of have to.
Hi, docs. How long are your typical wait times for surgery with you for out of Ontario patients who are your fertility patients? And are there ways to expedite?
There is no way to expedite. Our surgery times are unfortunately directly correlated with our anesthesia availability, which is not available. So it's very difficult for us to manage getting surgery times. And I kind of get in trouble when I operate on out of province people because they're like, why are you doing the out of province ones when you should do the in province ones? I don't care. I'm happy to take the heat, but speed is not happening anywhere in Canada when it comes to surgery. It won't work until we get the operations out of the hospital, which I am working on, but that's a slow process, but I am working on it.
You mentioned using an AI app for quick answers to medical questions.
Yes.
What app do you use?
Consensus.app. CONSENSUS.app. It's fabulous. It's really good. And we're developing our own. We're actually going to piggyback it on Consensus, but yeah, we're developing our own fertility related app. It'll make you like presentations of topics that you want to learn about.
Hi, Dr. VNT. Do you do anything different with FET if HX is ectopic, tube removed?
We would make sure your tubes didn't have hydrosalpinx. We probably wouldn't put the embryo quite as high, but that would be the only thing.
Do you have any feedback regarding the potential link between MTHFR and autism?
Well, there's there's always an autism question. So there's weak data that is currently being exploited showing associations between folic acid and autism. The last study I looked at on this had demonstrated that if you had 17 times the upper limit of normal, you had an increased risk of autism. Well, listen, if you have 17 times the upper limit of normal for cornflakes, you probably have an increased risk of autism. I mean, that's insane. No one should be taking 17 times normal anything. So anything in excess is probably not great. I am not, however, saying anything in moderation is okay. Some things are not okay, but anything in excess is probably a bad idea. So the problem with MTHFR is that you can't process your folic acid the same way everybody else does. And so we don't know for sure if that's associated, but there is some association. This is not entirely unlike the Tylenol thing. So for those of you that have been watching, you may as well turn this into video.
I hear that. I saw it coming.
Yeah. So for those of you that have been watching the whole Tylenol shenanigans with RFK saying it's causing autism potentially, or at least, that's what they're saying he's going to say. And the recent study coming from Mount Sinai, which demonstrated that there is an association between Tylenol exposure in pregnancy and autism or neurodevelopmental disorders. The problem with all of those studies is that the confounding variables are very difficult to tease out. Infection, inflammation, family history, dosage of exposure, timing of exposure, duration of exposure, the genetic history of the family, previous history of autism in the family. There's so many factors that are hard to control for. So in this recent study that kind of blew the doors on this, what they did was they analyzed everything, and then they have this one paragraph that says, even when we looked at the confounding variables, it still showed the same effect. Well, that's not true. First of all, they don't provide any data or any evidence of that anywhere in that paragraph. There's no table attached to it. There's no graph. There's no chart. There's nothing. They just say it. And the reality is that when you actually look at the individual studies, we know that the studies that showed a correlation between Tylenol exposure and autism or neurodevelopmental disorders, actually, most of them lost or drastically minimized the association when they were properly controlled for those factors. So we don't actually know if Tylenol is associated. Like, this study made big news, but it's not the right study. You want the right study, do a randomized controlled trial. Take some women, tell them it's okay to use Tylenol during their pregnancy. Take a group of women, tell them no Tylenol during their pregnancy, control for all the other factors, and then see how many of their kids develop autism. That's a proper trial. I don't know if it's ever going to get run, but that's the proper way to run that trial. So the reality is, with these observational type studies, nobody knows. We're never going to be able to figure it out. And if you look at association studies, you have to remember it doesn't represent causality. Just because something's there in an association, it doesn't mean that the Tylenol is causing the autism or the neurodevelopmental disorder. As a great example, if you evaluate this from the standpoint of what necessitates Tylenol, many times it's an infection, right? You've got a cough, you've got a cold, you've got the flu, whatever. You're taking Tylenol to keep your fever down, which is critical, by the way, when you're pregnant, because fever causes miscarriage, and fever and infection are very well established as being correlates of neurodevelopmental disorders. So was it the Tylenol or was it the infection? Was it the Tylenol or was it the fever? We don't know. So sure, there may be something to this, and I'm not going to go on here and say, there's nothing to it. There does seem to be some relationship, but we don't know where the relationship is. We don't know if it's the drug or what's causing you to take the drug. So that's the main problem here. And I'm not telling my patients to abandon Tylenol. It's being used for like 50 years. We're not seeing a rise in autism because of Tylenol use. Tylenol use hasn't crept up in pregnancy. So I don't see the correlation there. There's this great post by Ninny and the Brain, I think, on Instagram. And she has a post that showed that she was convinced that there was something more to this autism. I mean, it's tongue in cheek, but she goes, look, it must be yoga, because the rise in autism exactly mirrors the rise in uptake of yoga. So then she goes, no, it can't be yoga. That doesn't make sense. It has to be yoga pants. Look at the Lululemon profits from selling their yoga pants. it exactly mirrors the same thing. And then she says, well, it couldn't be that. Maybe it's something else. Maybe it's our diet. What about avocados? Rise in avocado consumption exactly mirrors. So we don't know, right? Like there's all these associations, but you can't blame autism on one thing. It's multifactorial for sure. And we don't know which ones are primarily responsible. Who knows if we ever even will. You're stuck.
Just making sure. Okay. Is letrozole plus Lupron good for 2 months before egg retrieval for advanced endo patients?
No, terrible. Any type of suppression prior to your egg retrieval will shut down your ovaries and prevent them from making as many eggs. Don't suppress prior to egg retrieval. That's been proven to be detrimental.
Does birth control affect fertility? Thanks to your protocol, welcome baby 6 weeks ago. Open to more kids, but not ready yet. And scared to get pregnant unexpectedly and miscarriage without prednisone and heparin.
So first of all, congratulations. That's awesome. Second of all, thank you for using our protocol and succeeding. That's further awesome. And third, yes, birth control will affect fertility if used immediately prior to conception. But does being on birth control reduce or alter your long-term fertility? No, that's being looked at very carefully, and there's absolutely zero association. In fact, if anything, theoretically, there's probably a benefit to being on birth control because you reduce the number of eggs you release and you reduce the risks of developing endometriosis. So it's not harmful to your fertility unless used right before you try to conceive. So I do recommend you go off it a couple of months first. And it might theoretically be beneficial. There's no data for that, but it might be beneficial.
Hello, amazing doctors.
There you go.
You and me.
You're just loving this, man. You got it. You know what? You should just go to med school.
I bet you I'd kill it. I bet you I'd kill it. Right into the specialty. Nothing before. Right in.
What would you choose? Oh, you would do it, eh?
100%.
You'd go into infertility.
No question. I'm a natural. I'm a natural at this point. What a waste of knowledge if I went anywhere else.
That's probably true.
Yeah, like, come on. I am the official, unofficial Fertility Factor prediction host. So the question is, hello, amazing doctors. My HCG on 13DP5DT was 445.
Okay.
Previous pregnancy was 950 at 13 days. Should I be worried?
No, that's still a reasonable level. HCG levels are actually correlated with your age. So depending on, your age, how much older you are than before, the quality of your embryo, when they tested, how they tested, all that stuff, the day of the embryo, day 5, day 6, like a lot of that can have an impact.
Dr. T and V. Caught that?
Wow. I caught that.
That?
I'm just relegated down to V.
Just saying. You're thinking I should go to medical school?
You and I need to switch seats.
You know what it is?
Like, I'll push the buttons. You come answer the question.
It's officially become, it's not an assumption that I should go to medical school. It's turned into, when did I graduate?
There was a guy responding to RFK Jr. saying, like, everybody in med school needs to go to nutrition. And he said, no, just make everybody go to med school. Make the entire population spend 2 years in medical school so we can stop all the nonsense online. I was like, you know what? That is probably the single most brilliant comment I've ever heard, because then you wouldn't have all these unhinged, crazy people saying vitamin K is bad. We're still, that new post, we still have people on there saying vitamin K is low for stem cells. Oh my God. We have people saying, vitamin K is low because God wanted it that way. I'm like, God doesn't want babies to die. And my all-time favorite, and I didn't publicize this, although I actually made the post and it's ready to go, but I didn't do it.
Make it right now.
I got my first death threat.
Oh yeah, right.
I had my first ever death threat. Some unhinged loony who, for some reason, is on my post explained to me that it was effeminate, pompous men like me that were the reason for the US Second Amendment, which is the right to bear arms. And he told me I was a tyrant because I'm trying to save babies' brains from having hemorrhagic strokes. How does that make me a tyrant? He's like, you should let people choose. I never told people they can't choose. I'm just telling them they're stupid if they choose to let their babies have a stroke. I think anyone would tell somebody that they were stupid if they were doing something that let their kids have a stroke.
You know, when it comes to it, what's interesting about that is, let's say, I'm going to play devil's advocate for a moment, so I hope this stuff doesn't get cropped out. But let's say vitamin K causes a 90% chance of having a stroke. 90%. Let's say, hypothetical scenario, very hypothetical. Fake scenario, okay? Just to make sure. Fake scenario. 90% stroke. But now your kid is suffering from a stroke, and the doctor says, hey, there's a 10% chance they'd be okay. You know what every parent would say?
Give it to them.
Give it to them.
I know.
Give it to them.
Well, that's the funny thing. If your kid comes in, not funny, but if your kid comes in and is having a hemorrhagic stroke, what do you think they're going to give the kid? The very first thing they're going to fire in is vitamin K to stop the bleeding. Like, it's just so stupid. It just makes no sense. And all these, every time we put up a vitamin K post, 200,000 views.
I keep going for it.
I know.
I see vitamin K mentioned. I'm like, drop it.
No, it's completely insane. And then all these people with these stupid, ridiculous, made-up fantasy theories that have zero evidence for them. Specifically, I love ranting about this. There is no evidence whatsoever that vitamin K helps to deliver stem cells to parts of the body. Low vitamin K does not make baby's blood more thin so that the stem cells can travel. It's just total freaking gibberish people have created out of the blue. It's crazy.
There was actually a post I saw on some platform. There's a lot of them, right?
Yeah, there's a lot of platforms.
And the guy was saying, you know, if someone wanted to tell me to take this vitamin because it's good for me, okay. Like, he's a very popular guy, right? But my mom has cancer, and you're telling me to go and do this pseudoscience thing and feed her garlic. And he said, go to hell. Like, I'm going to go to the doctor. Like, that's where I'm going. I'm going to the doctor. I'm not a sellout. I'm not an idiot. I'm not a loser. I'm going to the doctor. Like, did all of a sudden he went out hard. Like, it reminded me, like, he went out so hard to say, did suddenly every idiot in the world become a doctor that we don't need doctors anymore? But You know what? The minute I have a real problem, I'm going to my doctor.
Right. Well, that's what I say to everybody, right? Because they're like, you know, you do your own thing. I'm going to stick to no injections and no shots and no man-made blah, blah, blah. And I'm like, good luck when you're in a trauma and you don't want vitamin K. You can just let you or your kids bleed to death? I don't think so. But people don't get it. We had one of my favorite patients messaged me because she was on a post where the woman was talking about being like a birth attendant. She's not even like a midwife or a birth attendant. Yeah, she's a birth attendant. And the birth attendant claimed she had more experience delivering and managing deliveries than I did.
For the record, I was also a birth attendant. just putting it out there. And I have no business on the other side, but I was fully an attendant.
Yeah. Yeah. I love that. Like, if any birth attendants are watching this show and you think you have more knowledge or skill than I do, I will happily set up an emergency drill and have you show me whether you or I could manage this better. And we can even bring an entire panel of doulas and midwives and OBGYNs and lay people and have them all tell us which one, won. Anytime. I will happily challenge any birth attendant to that. I love the fact that they're so unhinged. They actually think they know more than someone who's studied it for 5 years, not sleeping, passed exams, certification, and then practiced it for over 20 years. Like, where do people get off on that? I have Google. More experience than he does. Like, what the hell? Oh, crazy.
Carly says that she gets death threats every day as well.
Carly gets death threats for having a cute baby? That's insane. I'm sorry, Carr. It's crazy. I couldn't believe the guy. But I found out where he lived through the help of a friend, and I reported him to Instagram. So I know where he lives. I even know where he had his wife's ultrasound done because that showed up on their Instagram.
Oh wow.
Oh yeah. I was like, I want to
the
know where this
whole
guy.
thing's public, and this guy's wow, that's hilarious.
Wow, when I get a bullet in my head,
Yeah,
I
sure.
want to know where it came from, right? So
you know a lot now.
oh yeah. I
That's
was like, I'm
wild.
gonna do a little bit of sleuthing here. Yeah. Carly, you don't deserve anything but love and affection. How's that?
What is your recommendation for estrogen dose for IVF transfers with stage 3 endo? Recommendations for IVF protocols for those with autoimmune Hashimoto's?
Minimize the estrogen. So high estrogen levels for endo cases are terrible. So we try not to give any. And if we do, minimum 1 milligram, 2 milligrams. Also for Hashimoto's or autoimmune stuff, we'll frequently throw in medications or supplements that will control the antibodies. We follow the thyroid levels pretty well. And for the really tough cases, sometimes you need more, like intralipid steroids, that kind of thing.
How long is the wait for excision surgery as an existing fertility patient?
Oh, forever. 6 months to a year if you're just starting with us. Surgery, I love surgery, and I won't pat myself on the back, but I will say that there are very few things in the minimally invasive or open surgery world that I cannot do. But getting surgical time, like, it sucks. I mean, right to Windsor Regional Hospital, right to the government, tell them that we need more anesthetists. They need to create CRNAs, certified registered nurse anesthetists, so that we can actually have anesthesia and then fund the system enough so that we can provide patients with OR time. I love the OR. If you said, give the clinical stuff to someone else, go operate all day, I'd be your first guy. Like, I freaking love being in the OR. It's my favorite thing to do. And I hope that I'm good at it. I think I'm good at it. But like, you can't get time. That's the major issue. We did a dermoidectomy the other day, last Wednesday, or last Friday, sorry, where I had to take a dermoid cyst out of a woman's ovary. I did it with the resident. It was beautiful. Like, it was just our medical student and Dr. Mayran. It was perfect. We didn't spill any, nothing leaked. We put it in a bag. We pulled it out, not a drop anywhere, no damage to the ovary. It was like the best ever. I was so happy. Intact dermoidectomy. It's fun. It was quick. It was simple, super safe. Everything went great. But like, I can't do it nearly often enough. There's just no time. There's zero time.
I'm transferring my last embryo with you next week. It's either a day 5 or day 6 and a 4BB.
Nice embryo.
Our chances low of it not surviving the thaw. Very anxious since it's my last chance.
No, I'd say about 97% of our embryos survive the thaw. There's the odd one that doesn't, but almost all of them survive the thaw.
Hello.
So don't be anxious.
Hello. I recently got laparoscopic surgery 2 weeks ago for ectopic pregnancy and found severe endo. It's all cleared part of the surgery. Do I need to go on Lupron suppression before I start IVF?
No, you should never go on Lupron suppression before your stim, only after your stim for your frozen embryo transfer. Now, if you're waiting till January, you could talk about some kind of suppression just so your endo doesn't come back, but you don't need Lupron prior to stim. We'd probably put you on Vizam and then stop it a month or two before your stim.
I'm 38, AMH 0.11. I've had 2 egg retrievals. The first one, 5 retrieved, 1 euploid. The second was today, 7 eggs retrieved, 4 mature. There is hope, ladies. Just wanted to share.
Oh, that's great. Thank you for sharing that. I love that. You know what? We need more of those. People who want to share stories, share your stories. We would happily put those up on our Instagram. Yeah. In fact, you know what? We should do a call for, success stories so we can share them. Yeah.
I just had my tubes removed, but saved the ovaries. Tube was filled with fluid and the other was twisted.
Yeah.
My follow-up appointment isn't for 6 weeks. What are my chances of getting pregnant?
0 if your tubes were removed. It's actually technically 1 in 1,000, but it's probably very close to 0. The data says 1 in 1,000, but realistically, if the tubes were removed, your chances would be negligible.
Is letrozole and Lupron suppression for 2 months good before egg retrieval for endo patients? What's the best protocol for endo patients before an egg retrieval if I've done 2 cycles with no visible embryo?
No, Lupron and letrozole beforehand will not be helpful. Ceremimis is being shown to be beneficial. NAD plus might help. The supplements might help. The right protocol will help. The right clinic will help. But not doing a suppression cycle. That'll actually just make you make less eggs. So that's not a good idea at all.
I read the question. We love Dr. T.
Yes, that wasn't a question. It was a comment.
Yeah, but there's a question after that.
Oh, no, you didn't.
Right.
Maybe. I don't know.
Let me know if I didn't read it. We love Dr. T. Just got my Fertilysis results.
Okay.
I have low T and full HLA
No,
match
you did that one.
with my spouse.
Yeah,
we did that, right?
Yeah,
I thought that low T.
Yeah.
What test can be taken to diagnose endo or adno? Every embryo transfer has been a fail. My doctor is giving up after 2.
Well, first of all, no doctor should be giving up, right? We give up when you give up. We don't give up or shouldn't give up until you say you're done. Like until you say you're done, it's our obligation to help you. So I've never even heard of a doctor giving up, especially after 2 embryo transfers. That's ridiculous. So I would suggest that there is no test for endo, despite what some people want you to believe. There are tests for adno, ultrasound or MRI can detect it. For endo, you need laparoscopy. There is no workaround.
Hashimoto's is super high TPO, but well-controlled TSH still calls for RPL?
Yes. Proven. Easy. Yeah. Get on selenium, inositol, and black cumin seed, which apparently, according to Tarek, my very religious friend here, is in the Quran. Apparently, everything is healed by black cumin seed.
And honey.
Everything. Are you supposed to mix them or just separate?
Oh, I'm sure you can put them together. Why not? It's like a super combo. How could it be bad?
I don't know what that would taste like, but yeah.
Oh, honey's good. Black seed's good.
Just come
on. You guys put black seed on your bread? You ever do that? You guys sprinkle it? Yeah.
Persian,
yeah, right? You guys do that, right?
Persian bread has
Persian bread, yeah.
Although I don't like it when it has the black ones.
Oh, really?
No.
It's good with sugar, to be honest. You know what? I think it is good with honey. I think I've had some Yemeni pastries where they have like a dough and then cheese inside, like a cream cheese, and then they put honey and the black seeds on the dough. I'm a fan of that taste.
I'm not even sure I've had black cumin seed.
Dr. Victory. What are we doing here?
I don't know.
You know what? We'll get it from
you and I have a buffet full of Chinese food.
This week and next week, Chinese. After that,
yeah,
we'll figure it out.
Yeah, we're still going to have all that food next week.
I know. That's going to stay there for a while. Is there any benefit to taking serapeptase, high-dose CoQ10, steroids, or antibiotics, or some kind of primary like ceremimis before a progesterone protocol cycle if I can't do antagonists?
Yes. Ceremimis might help. NAD plus might help. Serapeptase, there actually was one study on. I didn't dive into it too much, but there is some evidence for that as well. Yeah.
Any chance of lining regrowth when it stayed stagnant at 3 millimeters for 9 months with no intervention? Worried it's damaged beyond basal layer.
I mean, I can't answer crystal ball questions. Could there be rejuvenation? Maybe. Will there be? I mean, that sounds kind of concerning, but it's possible.
Dr. V, I just got referred to you.
Okay.
And I have a 6-centimeter endometrioma.
Okay.
I had surgery last August, and this is a new cyst. Do I need it removed before IVF treatment?
You got to come and see me. I mean, if you already had one removed and you need another one removed, that ovary, especially if it's from the same ovary, will likely become very, very weakened, especially with a big endometrioma like that. So you need to come and talk to me. We have to talk about the risks and benefits. It's not easy. When you get those big endometriomas, the problem is it can impede your ability to do the egg retrieval. So that can be really complicated.
What is your take, Dr. Victory, on highly individualized early retrieval in older patients?
So probably in about a week, I'm hoping 2 weeks max. We're going to start doing in vitro maturation for older patients. So as soon as I get the go ahead, we will blow up the internet with this because it looks like it might be very powerful. So we don't know yet. We're doing it as a research trial. We don't know if it works, but we think it'll actually solve a lot of problems. Additionally, there is a company that I'm not allowed to mention that is actually working on a methodology that will allow you to drastically reduce the number of genetically abnormal embryos by adding a certain substance in, but you have to mature the eggs to do it. So we're going to be poised to do all that. It'll be pretty awesome.
Question. Do you want to do this?
Should we?
I don't know. I think you should make it like a challenge. If so many people log in, if they're able to get enough people on the show to justify you showing this, because this is something. If they want to see it, they can work for it. I think that'd be the spirit.
Get some others on the show.
Yeah, get some others on the show. Let them know, Dr. Victory. Tell them.
It's a image of a anatomical part that we evaluated after the patient had had treatment at another clinic with 5 previous embryo transfers. It's a very telling picture. A little depressing, to be honest with you, but yeah, let's build up the show, gets lots of likes, and maybe we'll.
If there's enough people that go on the stream, like if we hit a record on the stream, like if we get 100 people on TikTok, that's going to be the number. If we get 100 people on TikTok, I think it would be fair.
What time is it? How much time do they have?
They got it's 8:52. They don't got much time, but that's what makes it more so exciting.
Minutes? Yeah, it's a race now.
It's a race. It's right. Load it up. Load them up on TikTok. Load them up. If we get 100 people on one platform in one moment. So right now we got about 60 on Instagram, and we got about 30 this exact second on YouTube, right? Yep. And then we got 35 on TikTok. So if they can make 100 somewhere,
we'll do it.
I won't show you, but it's a doozy. It's a doozy. All right. Next question. Hello, please. What causes small amounts of red bleeding and pain? 8 DPT. Thank you.
Implantation bleed, probably miscarriage, failure, anything like that could do it.
Remember, guys, the first platform to 100 wins. 39-year-old with Hashimoto's, endo, all 8 PGT abnormal on 3 ER with Clomid, Menopur, Gonal, Ministim, any rec.
So she's had 3 egg retrievals and she got 0 euploid embryos at 39.
Yeah,
that's bizarre. First question is, why are you doing Ministim? Second question is, what's your partner like? I would need to talk to you. You need to reach out.
So they're climbing on TikTok. They're climbing on it. Like people are coming on, guys. I'm telling you, look. I don't do this ever on the show, to be quite honest. I've never done this. This year, these things,
gold. You
will lose your mind.
Yeah.
If you saw this, promise. But you got to work for it. I can, just trying to help you guys out. Give you something to talk about.
Yeah.
Hello, please. What causes small amount of red bleeding? Oh, we did that. Hey, Dr. V. I ovulate on my own monthly, but my follicles are always over mature. AMH 31.7.
I ovulate on my own, but my follicles are always over mature. Do you mean they're growing really large before you release them? If that's the case, just take the trigger shot when they're smaller and they'll release earlier. That's not a problem. You just have to be monitored. We do that for timed intercourse all the time. Once they get to the right size, we give you an HCG shot. Boom, you're going to release your eggs. So you don't need to wait till they're post-mature, so to speak.
People are trying to get a cheat code to get 5,000 likes. No. We're not doing likes, guys. You can give us as many likes as you want, but to get the gold, yeah, you got to share this video with your friends right now. Right now, call your friends, message them, DM them, share the link. Hey, get on Dr. Victory's show right now. They got something good. I promise it's good.
Yeah,
I promise it's good. When I saw it, hey, when I saw it, lost my mind.
My junior nurse was absolutely devastated by what she saw today. Like, that's saying a lot. Yeah. Like, she was emotional about it. She was freaking out that this had been missed or ignored. I can't.
Oh, it's unbelievable.
Yeah.
If I can be quite honest,
I
it's
don't
actually
understand how you
unbelievable.
missed
I don't
that.
know.
Yeah.
No. I will say, if I was a doctor and I missed it once, I didn't do my job.
Yeah. Like, I don't.
If I missed it once,
Yeah.
that's how wild this image is.
I don't get it.
Anyways, guys, you got 4 minutes to get it together. Otherwise, it's on you.
Wait till
don't
next
complain.
week.
Yeah,
Yeah.
don't complain. You didn't get dibs. Back in February, my AMH was 4.4 picomoles. How many years do we have left at the minimum to conceive if I'm 31 years old? Also, we are talking about IVF or IUI. Given my results, which would you recommend?
So I can't tell you how many years you have left because your AMH is very low for your age. And the process that has led to it being that low can sometimes be, unfortunately, very rapid. So you could be out of eggs and be menopausal within a year. Like, there's no way to know because you're on some path that is not the normal path. And so your ovaries are very rapidly declining based on your age and that AMH. If it was like a gradual, slow decrease, you probably have like 3 years before, 4 years max before you're in menopause, I would guess. But most of the time when it's that low at that age, it's faster. Which one would I do, IUI or IVF? I mean, it depends on how many kids you want, right? If your AMH is that low now and you do IUI and you are successful, you're probably going to have trouble with the next one because your AMH will be very low. If you do IVF, you got to go into it knowing you're going to need to do it a number of times because that's a really low AMH. So, you got to decide what's right for you. There's no single answer. You just got to say, this is what we want.
So in the TikTok section, the comments,
Yeah.
because I said if I was a doctor, I'd make the mistake. If once, they're like,
Yeah.
I'm not a doctor. I'm like, yeah. And I'm like, yeah, I know I'm not a doctor. That's how crazy this image is. The image is insane. How do we submit questions, Dr. V?
Just submit them. Like, you just go on and how you just submitted a question? You just submit it like that. Yeah.
Oh, I see. Some people are like, oh, I've submitted twice. I didn't get any answers yet. Wow.
We got a lot of people that come and go on the show. At any one time, there's 60 people, 30 people, whatever, 50 people, sometimes more. But overall, 5,000 people a week come on and off of this show. So there's like a lot of questions we have to answer.
There's a lot of questions. That's right. I asked very early and again recently. I think they skipped it. No. We didn't skip it, guys. We skipped nothing.
Do you have a question from that person?
Let's see what this guy's name is. Let's see real quick.
Again. I don't think that's going to be real quick. Just go right to the beginning. Do you have their name?
Yeah. Question, might not have sent. Suspected endo, severe MFI. Yeah, failed NMFET with letrozole. Doug doesn't think endo is a factor. Do you recommend trying same protocol again?
I would need to know your protocol. Reach out to me because that question didn't make sense. I need to know what your protocol was. You just asked me if you should try the same protocol, but I don't know what they did. So I need to know your protocol first.
I'll just very quickly scroll up to see if they mentioned their protocol, just for benefit of that. So no one says I didn't ask the full question. Nope, sorry, man. Not here. Although there's a lot of questions. Like when you scroll up on this thing, wow, amazing. Is natural modified with letrozole okay for suspected endo? That's the protocol.
Yeah, that's great.
Clinic doesn't think it's a factor and initially recommended fully medicated. Failed first transfer. IVF reason is severe MFI. I'm requesting PI. Oh.
Yeah. So you need double progesterone. You need high dose. You need natural supplements. Endo is a factor. It always is. Anyone telling you otherwise is lying to you. Yeah, and we use an immune protocol. So we have a whole dedicated protocol that just, it's like world famous now because people message me all the time saying, hey, we used your protocol and it worked. We didn't hit the target. That's okay. We'll share it with people on a post.
So guys, look, we're going to have a post. We're going to have a post where Dr. Victory is going to be holding up pieces of paper. When you see that post, remember, it is insane. That's my advice for that.
Like, comment, share.
Like, comment, share.
What time is it?
9:01.
Oh, all right. We got to go clean up the kitchen, dude.
We definitely
last question. TikTok.
I waited 4 months and I have an appointment next week.
Oh, wow. Okay. That's
I don't know if that's what I should have ended it on.
Yeah, I know.
that was the one. Okay, let me see where I left off here. Insulin level. Okay, should all IVF transfers have a trigger, and does baby aspirin for IVF over 35?
No, they don't all need a trigger. That's been proven, and baby aspirin should be used for everybody, in my opinion, because it's beneficial. But not everybody needs a trigger. No, that's been proven. They've done so many studies on that. There's no benefit to HCG. In fact, we don't use it. Yeah. Even in those months where we were getting 90%, we still weren't using it.
AMH dropped from 6.6 picomoles per liter to 4.6 picomoles per liter within a year, 0.31, 31 years old. Secondary infertility. Anything?
I mean, I would need to know why your AMH dropped, but if it was that quick, I'd be worried about endo. I believe women with endo have much more rapidly declining AMH levels.
My right tube is blocked and I have more dominant follicles on the right side. Left has small size eggs.
IVF.
Hi, Dr. VNT. I had 2 IVF cycles with no normal embryos. I have stage 3. Did Vizan. Anything else?
Oh, huge. Our endo protocol, potential surgery, natural supplements, immune stuff, ceremimis. There's all sorts of things you can do.
Conceived on letrozole, 5 weeks pregnant, had gush of blood, 1 diameter size clot, lasted 2 to 3 minutes, then stopped.
Go get checked out. Anytime you have bleeding in pregnancy, you have to go get checked
out. Already did ultrasound booked for tomorrow. MFM didn't say anything further. Was wondering if subchronic hematoma or miscarriage.
Well, you'll need to have 2 beta HCGs to figure that out, 48 hours apart.
Any tips for weight loss before an FET other than GLP? Trying so hard, but having a hard time since IVF.
Listen, the entire weight loss industry is a scam as far as I'm concerned, right? So weight loss is easy. It's calories in and calories out. That's all there is to it. Like people say, oh, it's, this and that. It isn't. If you take in 2,000 calories and you burn 2,000 calories, your weight's not going to fluctuate much. If you take in 2,000 calories and you burn 1,500 calories, you're going to gain weight. Like it doesn't matter what you do, you're going to gain weight. Unless you made like a massive amount of muscle with your 1,500 calories, which is unlikely, but whatever. If you take in 2,000 calories and you burn 2,500, no matter what you do, you're going to eventually lose weight. Biologically impossible not to. So it's just being in a calorie deficit. As soon as you're in a calorie deficit, you're losing weight. That's all there is to it. So you just have to make sure you actually burn more than you take in. The problem, most people think they eat way less than they actually do. So if you actually get like a calorie counter, like MyFitnessPal or one of these apps that lets you enter every single thing you're eating. If you actually enter all of that in, you'll realize in most instances, you're probably taking in double what you actually think you are. And most people think they're burning lots of calories when in reality, you're burning nothing. Like people are like, oh, I'm standing, I'm walking, I'm busy all day. Like I don't get to sit. I'm just running back and forth between this office and my OR and this room and that room and nonstop all day long. I'm still not burning calories. Like that's just normal daily output. So in order to burn calories, you got to go to a gym and you need to build muscle. But once you do that, you will lose weight. Plain and simple.
And I think one thing's actually important, if I may add a weight as
Sure.
a person suffering with constant gaining of weight. You aren't hungry. I think that's a very important thing. You're not actually hungry. What you are is wanting to eat.
That's true.
Right? That's the thing. A lot of people think that they're actually hungry, so they'll eat one plate, eat a second plate, eat a third plate, eat dessert. And you could have been done after half
The
of the
first
first
plate.
plate.
Yeah.
Half of the first plate, you would have been done.
Yeah.
So wanting to eat and being hungry is something I think all of us need to get used to.
Well, and that's what the GLP-1s do.
That's what I'm saying.
Yeah.
This is the natural way to do it,
Yeah.
because the question was, how do you do it? That's how you do it.
And
Just be hungry after dinner. You'll be all right.
I'm at my lowest weight in at least 10 years, if not more.
Hey, round of applause for that.
And I am on a GLP-1 because I don't have time to exercise, and it's working. Like, I lost a ton of weight, which is good because I needed to, and I sleep better now too.
Oh, really?
I'm not snoring as much.
No way. It's a thing, eh?
My wife was like, "You're a freight train" before, and now she's like, "If you do snore, you snore really quietly."
Now you're like the Via.
All right, folks, we love you all. We are going to draw this show to a close. Thank you for joining us on Fertility Fact or Fiction. We will see you again next week, where we will present that new article, which can actually predict whether or not you will produce a euploid embryo based on which category you fall into. So we will share that with you next week. I think that'll be super cool. And otherwise, have a great week. May all your fertility dreams come true.